Imagine this: you're navigating through life with PCOS, facing daily struggles with irregular periods, unwanted hair, and managing weight. Then menopause looms, bringing new symptoms and changes that can feel overwhelming. What happens when these two hormonal challenges intersect? It's time to understand the journey your body's hormones go through and what this means for you, whether you're in your 20s, approaching menopause, or already there. Main content. 1. Understanding the essentials, PCOS versus menopause. Let's start with a quick breakdown of what PCOS and menopause mean for your body and your hormones. Polycystic ovary syndrome, or PCOS, is a hormonal condition that usually starts in your teens or 20s. Its main signs? Irregular periods, higher than usual levels of testosterone, and sometimes, ovarian cysts. These symptoms can make everyday life challenging, from skin issues like acne to difficulty with weight and hair growth where you don't want it. Menopause, on the other hand, is the body's natural way of ending the reproductive years. Typically happening around age 52, menopause kicks in 12 months after your last period. Hormones like estrogen and progesterone start declining, leading to symptoms like hot flashes, night sweats, and mood swings. Key takeaway? Both PCOS and menopause are deeply connected to hormone changes, but they impact your body in unique ways. 2. The role of hormones in PCOS and menopause. In PCOS, there's an imbalance, often with too much testosterone or other androgens. This can lead to acne, excess body hair, and even issues with insulin, which can put you at a higher risk for type 2 diabetes. During menopause, it's the decline of estrogen and progesterone that's the main event. It takes about 4 years for these changes to fully develop, and this phase is known as perimenopause. Throughout perimenopause, your periods become irregular, and you might start noticing those classic menopause symptoms. Here's the twist: while PCOS doesn't disappear with menopause, the hormonal landscape does shift. Some symptoms of PCOS, like irregular periods, might even get a little better as you approach menopause. But new symptoms, like hot flashes, can add to the mix. 3. PCOS doesn't disappear after menopause. Menopause might mark the end of monthly periods, but it doesn't necessarily mean the end of PCOS. In fact, people with PCOS have been shown to have lingering hormonal imbalances and are often at a higher risk for metabolic issues, like heart disease, even after menopause. This is where managing PCOS early on becomes so important. Researchers have discovered that people with PCOS tend to have a different hormone profile than those without, even after menopause. So, while menopause may change the way you experience PCOS, the condition can have a lasting impact on your overall health. 4. Similarities and differences. Symptoms overlap, but the causes differ. Both PCOS and menopause can bring about a roller coaster of symptoms, like mood swings, trouble sleeping, and even weight gain. These overlapping symptoms can make it tricky to tell where one condition ends and the other begins. Let's break it down a bit more. Symptoms of PCOS: acne, ovarian cysts, irregular periods, higher levels of androgens, leading to excess hair growth or hair thinning. Symptoms of menopause: hot flashes, night sweats, irregular periods leading to no periods, decrease in estrogen, which can affect skin elasticity and bone health. Bottom line: PCOS can continue through menopause, and while it doesn't exactly get cured, the symptoms may shift as your body changes. 5. Managing symptoms, lifestyle strategies for both PCOS and menopause. Taking control of your lifestyle can make a huge difference in managing symptoms for both conditions. Here's how. Weight management. With PCOS, weight gain can increase the risk of conditions like diabetes and high blood pressure. As you approach menopause, these risks don't go away. Focus on a diet rich in fresh fruits, vegetables, and whole grains. Stay away from processed foods, sugary drinks, and fried items. Not only will this help your metabolism, but it can also ease some symptoms of menopause. Consistent exercise can also play a role in keeping your body balanced. Aim for a combination of cardio and strength training to help manage weight and boost mood. Sleep. Sleep disturbances can affect both PCOS and menopause, so establishing a sleep-friendly environment is key. Make sure your room is dark, quiet, and cool. Try to avoid caffeine in the evening and limit screen time before bed. If sleep troubles persist, it might be worth discussing with your doctor. Hair removal techniques. With the increased body hair that can come with PCOS, some people may want to explore hair removal options. Topical creams, laser removal, or electrolysis can all be options, but it's essential to work with a dermatologist or professional to find the right method for your skin type. 6. Treatment options, what doctors might recommend. There's no cure for PCOS, but there are treatments to help manage symptoms. Common options include birth control pills, which can help regulate periods, or medications to reduce androgens. For those dealing with insulin resistance, metformin might be a helpful option. As for menopause, hormone replacement therapy, HRT, can be an option for managing symptoms like hot flashes and mood swings. However, HRT is not suitable for everyone, and there are risks to consider. Always discuss these options with your healthcare provider to find what's right for you. 7. Questions people often ask about PCOS and menopause. Does PCOS get worse with age? PCOS itself doesn't necessarily worsen, but the risk of related health issues, like heart disease and diabetes, can increase over time. This is why early and consistent management is so important. Does menopause improve PCOS symptoms? Menopause can bring regularity to periods for some with PCOS, but it doesn't cure the condition. Instead, the symptoms of PCOS may simply change or reduce over time. Can you still have PCOS after menopause? Technically, doctors stop diagnosing PCOS after menopause since the reproductive symptoms, like irregular periods, aren't relevant anymore. However, metabolic risks, like insulin resistance, often continue. 8. Your next steps, what you can do. If you're living with PCOS and approaching menopause, your health journey is unique. Regular checkups and proactive conversations with your healthcare provider are essential. Together, you can create a plan that considers your symptoms and potential risks. Remember, your health is in your hands, and understanding how to navigate PCOS and menopause can help you manage symptoms and enjoy a healthier future. Small lifestyle changes, thoughtful medical guidance, and staying informed can make all the difference. Conclusion: PCOS and menopause might seem like two separate challenges, but they're part of a continuous hormonal journey. It's about finding the right balance of lifestyle, medical treatments, and self-care strategies that work best for you. So, take charge, stay informed, and remember, you're not alone on this path. Empower yourself with knowledge, and you can make the most of every stage of life.